Australia has passed a grim milestone in its battle against COVID-19 with more than 10,000 infections now recorded. The deaths of two elderly patients in Victoria have taken the national coronavirus death toll to 110 as the states and territories urgently review plans and timetables to reopen borders. Overnight, supermarket giant Woolworths confirmed a staff member from its Bowral store in New South Wales' Southern Highlands has tested positive.
It comes as the number of cases linked to a cluster at the Crossroads Hotel reached 30. But New South Wales Premier Gladys Berejiklian has ruled out hard Victorian-style lockdowns, saying residents in Australia's most populous state need to find a way to coexist with the virus. Take a listen.
That's not a path we want to take, Michael, because what we have determined is the best course in managing this pandemic is what we call a suppression strategy. Unfortunately, what all of us have to accept is that as restrictions have eased and as people start to go back to work and go their daily lives, we are going to see those case numbers increase. As much as we'd love to have elimination, as much as we'd love to be able to be in that state, it's not going to happen in New South Wales. It never will.
Well, the outbreak in Sydney's southwest has prompted the Queensland government to ban anyone from a hotspot area in New South Wales from entering the state. Already, anyone who's been in Victoria has to undergo mandatory hotel quarantine for 2 weeks. So let's bring in Queensland's Deputy Premier and Health Minister, Stephen Miles. Stephen Miles, thanks for joining us this morning. Just quickly, before I ask you about those hotspots, what's the latest with those who've been tested that have been thought to have been at the Crossroads Hotel? But are now in Queensland?
Well, good morning and thanks for having me. We've had 18 Queenslanders come forward and say that they've been at the Crossroads Hotel in that period that we're concerned about, the 3rd till the 10th. At this stage, 11 of those have returned negative test results for COVID-19. The other 7 remain in home quarantine while we await their test results.
Do you have any concerns that there might be some who've been to the Crossroads that haven't got in contact with you?
Yeah, we are concerned. We understand it's a very popular stopping spot off the Hume Highway, that there were roughly 4,000 patrons during that period of time, so a lot of people went there, and so no doubt there probably are other Queenslanders who visited the pub on those dates, and we'd urge them to come forward and get tested immediately.
What's most concerning you about what's happening in Victoria and now New South Wales?
Oh, look, the biggest concern in Victoria is the number of cases that they haven't been able to trace back to a source case. That community transmission without a known source is very worrying. I understand they're working on more than 30 different outbreaks. That's a level of community transmission that nowhere else in the country has seen throughout the entire pandemic. And so all of the states and territories stand willing and ready to assist Victoria in doing what they need to do, tracing all of those contacts, identifying all of those sources, quarantining all of the people who could have been in contact with the virus. They're doing that work, but it's going to take them some time to get on top of it, and we really hope they do.
What is the exact rule about hotspot postcodes from New South Wales that Queensland now has regarding its border policy?
So it's the local government areas of Campbelltown and Liverpool. I understand the Crossroads Hotel is near the border of those, the boundary of those 2 local government areas. I know that's a large part of New South Wales, something like 400,000 residents. What we're saying to them is that they would need to be outside of that area for 14 days before they enter Queensland, and any Queensland residents who've been there would need to go into hotel quarantine on their return to Queensland.
Is it not just residents, those people that passed through there? So you have to have been outside of those municipalities for 14 days to get into Queensland?
That's correct. Just like our restrictions for Victoria, they don't just apply to people that live there, they also apply to people who visit there because they're just as likely to have been exposed to the virus.
You're proposing now, I believe, jail time for people trying to break those border laws and get in. We saw footage of 6 Victorians trying twice to get in, and they were fined something like $24,000. Are you proposing this because it's happening a lot? How often are people trying to get into the border illegally?
Look, our police have issued a lot of fines for various breaches of the health directions, not just at the border, but what we saw was that New South Wales had a punishment option of imprisonment of up to 6 months, and we wanted to bring our penalties into line with them. We were also concerned that people might think that they can try it on here in Queensland, and even if they get a fine, they might never pay it if they go back to their home state. And so we wanted to make sure we had penalties available for the most extreme actions, lying to police, trying to sneak around, trying multiple times, giving police an option of seeking imprisonment. We hope will act as a really strong deterrent. Ultimately, this is not about punishment. We don't want to be punishing people. We want people to abide by the rules so that we can keep Queenslanders and ultimately all Australians safe.
And the game parks are opening on the Gold Coast today, I believe. Tell us what this means for tourism, Queensland being able to edge forward in relaxing some restrictions.
Yeah, our theme parks have been gradually opening. They've put together very detailed COVID-safe plans in working with our public health units in the areas that they are predominantly on the Gold Coast. Those plans will see people starting to return. I understand our tourist centres are starting to come back to life. I got to spend some time on the Gold Coast last week myself with my family, and there were lots of Queenslanders. And then after Friday, after the borders opened, folk coming in from New South Wales, which of course is really great. It's allowing us to get more businesses opened up again, get more people back into their jobs.
Well, we hope that can continue. Stephen Miles, thanks very much.
Thanks so much for having me.
Let's go back to our top story, because we've been reporting that Australia's now recorded more than 10,000 COVID-19 infections. Our reporter Lily Mayers, who's in Sydney southwest, and Elias Kluwer, who's in Melbourne, join us now. Lily, tell us about this Crossroads Hotel outbreak. What's happening now? Are they still testing there, by the way?
Good morning, Lisa. They are still testing here. It's just about to kick off at 8 o'clock. It should have opened, so we're expecting the lines of cars to come up here any moment. There's 9 fresh cases associated with this outbreak. That's brought the cluster to 30 cases. And now health authorities are concerned that several other locations have now been linked to the Crossroads Hotel too. The Planet Fitness gym that's just down the road has had 2 fresh cases. That was after one person visited the Crossroads Hotel, then went to the gym. So anyone who visited the gym between the 4th of July and the 10th has been urged to go and get themselves tested and go into self-isolation. The Picton Hotel, which is about a 40-minute drive south of here, has also been temporarily shut down after an infected person visited the gaming room several times last week. And the Preston's Aged Care Lodge, which is just around the corner, has been temporarily put into lockdown after an infectious person visited the home also.
And Lily, do we know with this case that's popped up in Bowral, south of Sydney, where that came from?
They haven't told us what the source of that case is, but Woolworths confirmed a staff member did test positive after working a shift on Sunday, and the store has reopened this morning after undergoing a deep clean overnight. And
strong words from the Premier last night.
That's right. The Premier has confirmed that she doesn't want the state to go into lockdown like we've seen in Victoria. She won't be fencing off suburb hotspots. She said the government's got a tough job of balancing the well-being of people with economic recovery, so she doesn't want to see us going in and out of lockdown and having to pause lives and work so many times.
Thanks, Lily. Hey, Elias, I was a little concerned yesterday when I heard those numbers, the expectations of just how many people might end up in hospital because of this cluster that we're seeing here in Victoria.
Yeah, very concerning indeed. Good morning, Lisa. The Premier says hundreds of people could soon be admitted to hospital, which is quite confronting given there's already 85 people in Melbourne hospitals as a result of COVID-19. 26 of those are in intensive care. One of those people in ICU is a man in his 30s. Now, the Premier also says ADF personnel could be brought in to relieve frontline workers, including ambulance workers as well. Now here at the Royal Melbourne Hospital, a specialist ward has been set up to cater particularly for the elderly people. 80 people connected with aged care homes in Melbourne have contracted the virus, and tragically yesterday 2 elderly people lost their lives, a man in his 80s and a woman in her 80s also.
And Elias, the Chief Health Officer yesterday was also suggesting that maybe what we're doing now mightn't be enough to get on top of it.
Yeah, well, there's still over 1,800 active cases in Victoria, and as we've mentioned, hospital admissions are on the rise, but so is community transmission. There's over 100 different outbreaks, and as a result of that, the Chief Health Officer, Professor Brett Sutton, says that stage 4 restrictions cannot be ruled out. We could see what's been seen in New Zealand, so retail stores closed down and travel restrictions locked down once again, or more sort of harsher restrictions in terms of travel. Now, the news on Spring Street, or the information out of Spring Street right now, is that it isn't being considered, or it isn't on the table, because those stage 3 restrictions in Melbourne and the Mitchell Shire haven't been in place long enough to determine whether they're working.
All right, Elias and Lily there in Sydney, thanks.
I guess it just shows you how much we ride the numbers. A couple of days ago, Victoria saw a dip to 170, which is a lot, but relatively speaking, it was down. And then perhaps people thought, well, it's working, the lockdown's working. And then yesterday, those big numbers again.
Oh yeah, Brett Sutton, the Chief Medical Officer, said, look, we mightn't have reached the peak yet. So you've just got to prepare yourself for what's coming.
And it's hard. You've got to wait, obviously, to see whether the lockdown's working. Wait those 2 weeks. So. But it's good to get the day-to-day news for you and bring you the latest. OK, a British pub owner has taken what might be considered a shocking approach to enforcing social distancing at his bar. Johnny McFadden says he's installed this electric fence after realising a rope or signs wouldn't stop the regulars at the Star Inn from crowding the bar.
As long as it's a warning sign on an electric fence and you're warned about it, it's totally legal. And there's a fear factor, it works. People are like sheep, Sheep keep away, people keep away.
A man who respects his clientele there.
I'm off down to the pub for a cheeky point.
You'll be relieved to know that electric fence, Lisa, isn't turned on. And once word gets out that it's not on, he's going to buy a cattle prod.
No, the game's up.
I made that up.
Cattle prod.
Sorry.